Hello, my name is Magdalena Ankiersztejn-Bartczak. I'm CEO from Foundation for Social Education based in Warsaw, in Poland. My foundation for almost 20 years working in HIV field, and from 2003 we have testing places in Warsaw. Right now we hosted 2 places where you can do free and free of charge and anonymous testing for HIV, hepatitis C and syphilis. From the beginning, we are also a member of and start access to European Testing Week. For us, it's a huge opportunity to promote testing. You have to know that in Poland, only 10% adult people had ever tested in their life. So testing, it's very, very important to share information, to promote, but also to inspire people that it's something natural that you are doing testing by yourself, and you are also taking your partners, friends, colleagues to do this test. Our testing places are open for everybody who need it, but of course we try to dedicate it mostly for key population, and because Warsaw is very familiar and friendly for LGBT community, this is the part of our work and most population group in our testing places. Every year we have more and more clients, but of course we have also more and more positive results, and we try to help those people and support them after the positive diagnosis. In Poland, we have still Western blot confirmation, so sometimes it takes too much time. So I hope sooner or later, finally, we exclude this opportunity and send people directly to HIV clinic. Our linkage to care is very well because we have HIV clinic in Warsaw, and we have very good cooperation with clinician doctors and team and staff who are working there. In Warsaw, we have also good cooperation with other organization, also patient organization. So it's great possibility to help, to coordinate and cooperate between one to another. It's not so good in other cities because in Poland we have only 15 NGOs concentrated on HIV, but in the biggest city there are places that you can find testing, but you also have opportunity to go for NGO. European Testing Week, especially this year for us, it's a new challenge because, as all people know, after 24th of February, the reality, especially in Poland, was changed. Every day we have more and more people from Ukraine. We try to help them and support them as much as possible, but we also think and remember about the situation of people living with HIV in Ukraine, and also about testing for them. We try to organize testing service for them, but the bigger barrier is language, because not all of them would like to speak in Russian language, and also not all counselors working in the VCT centers can speak Russian language or Ukrainian language. That would be much better and easier. Of course, we try to fix to this old situation. And after 24th of February, very quick, we organized the leaflets and we translate questionnaire that we use on our VCT center. And we translated to Ukrainian language and printed it for our clients. That to have a better consultation with them. We also put the information, the main information in Ukrainian language about access for testing, access for care in Poland for people in HIV. It is very important to know that testing, but also care, it also includes treatment for antiretroviral treatment for people in HIV from Ukrainian. It's free of charge. So there is no barrier to take care and take treatment. But we have to all know that situation of epidemic in Poland and in Ukraine, it's extremely different. In Poland, we have 15,000 people living with HIV on treatment. We know that in Ukraine, there is 250,000 people living with HIV. So it's extremely different. And also we need to remember that Poland do not need only treatment, but we need also bigger staff to take care of all those people who need this care from our friends from Ukraine. It's also important on the VCT center because it's not like in other checkpoints in Europe that they are open 8 hours a day. In some cities like Warsaw or Wrocław, the VCT center are open 4 hours in the afternoon, and there are 2 counselors, and it's good situation because we are open 5 days a week. In the smaller cities, but also because of smaller funding, Krakow, Gdańsk, or Szczecin do not have this opportunity to have 2 counselors during the same time. So there is also a limit of people that they can take for testing. We have to remember that when we are taking Ukrainian people, we need to translate and need to very often longer time to help them, because it's not only a testing, it is also the discussion about all situation and life that was changed after the war. So when we are talking about services, there is a huge challenge. First of all, also to have opportunity to send and go with information about this access for those people who need it. Many people who are coming to Poland are staying in private houses. So it's even harder to ask the people with whom you are staying at house, where have to go for the HIV test, or where should I go for antiretroviral therapy. This barrier should be also included when we are thinking in the future with activities for those people. They need our help. They need us here in this situation right now. We need to find them to help them. We cannot expect that they will be asking all people around when they can go and have knowledge about HIV service in Poland. We need to send information. Foundation for Social Education and me, myself, we are trying to be in the European levels cooperation and put all information about how to have service for HIV in Poland in all possibilities. So we have cooperation directly with organization working in Ukraine, but also with neighboring countries. We are a member of EU Civil Society Forum, so exchange this knowledge with our friends. And also we know that there are a lot of platforms for Ukrainian people where can get information about access for HIV and service in individual countries. We have to remember also about the Polish situation with PrEP. We do not have it in public space. It's only in private, and you have to pay for that. And it's also, again, a difference between Poland and Ukraine, because there is a program from Global Fund and people have access for PrEP. In Poland, it's not free of charge. And we have still some question about where can I get PrEP for free in Poland. There are huge differences also with the situation with NGO working in Poland and also in Ukraine. We didn't have, never from the last years, we didn't have Global Fund money, but we also do not have so easy access for EU money. So most organizations base only on governmental level money or local money. So it's not enough to have a big organization. It's only based on the project. So most organizations do not have possibility to arrange any other activities dedicated for Ukrainian people because they do not have money for that. We try to organize, of course, and change the situation. We sending application, but all our work in the last 3 months was voluntary work. So you have to also know that all this VCT center do not have extra fundings for Ukrainian situation. Of course, we are doing as much as possible to open our services and to implement all changes that is necessary for new clients that we expected, and we would like to have it, because as I mentioned, there is still not enough people who find out the way for HIV service and HIV care. We need to take care of them and do not expect that they will be looking us. So we must be concentrate also on promotion, information, and educate also our staff how to work and how to break the barrier of language. And do not afraid, because we all know that Ukrainian people very often quite good understand also us. And even though we are not speaking in the same language, if you will, you can contact with them. We have these leaflets, we have the website, we have Google Translator. It's funny, but I don't speak even Russian or Ukrainian language, but still have every day from 5 to 20 asking where should I go for treatment. And it's, for me, it doesn't any problem to answer even in Ukrainian language, because there are applications to help me for that. So, of course, for everyone right now in Europe, it's a new situation, and we are just after the crisis of COVID-19. But NGO and people who are working there know that it must to be very flexible and change every day and concentrate on different things during the day. So we have to remember that the situation in Ukraine will not stop very quickly. Of course, everybody believes that war finally finished and the situation will be much better. But we have to also know and remember that it's a very long process of coming back for normality. And those people, some of them will stay as longer, some of them will have longer term of mental health problem. So we have to be very patient, but also think in the long term what to do. So I hope that our service and our cooperation and also our exchanging of knowledge and very close working together will help us together to go through on it. And I hope finally we will have normal time.